Hello, it's a girl again, Adventurer, and this time around I'm here to give you some tips, okay? Some tips about interview questions and what to do, okay? For some of us who are going for nursing interviews. Okay, let's get started. I wrote down some one or two things and I'm going to share with you. Yes, so when you are called for an interview, the first thing to do is you have to pack everything they asked you, the requirement they asked for, okay? And when you are called to go to the interview room, you quickly arrange those things and then send it to the interview room. Yes. So what you're going to do is when you go there, when you are in front of the interview room, you don't just open the door and enter. Listen carefully. You don't just open the door and enter. You knock, you stand there, then you wait till you hear, yes, come inside before you enter inside. And when you enter, you don't sit. You wait till they give you a seat to sit before you do what? You sit down. This is basic and you shouldn't miss it. Yes, you shouldn't miss it. You be given a seat before you what you sit down. And when you sit down gently. Do not cross your leg. I repeat, do not cross your legs. That place is not your office. Yes, you sit down gently, put on a smiling face. Do not be too serious. Okay, have confidence in yourself. Okay, that you can do this. Have confidence in yourself and then relax. Okay, and then put this in mind. Every question they ask you, smile, relax, and answer the question by first saying, thank you very much, please, for this question. Then you answer the question. Listen carefully. You start with, thank you very much, please, for this question before you answer the question. Okay, these are basics. Okay, so I've said everything here. I've just said everything. You then avoid the usage of um, no. Avoid the usage of I think so. That you are letting them think you don't even think so. Yes, you are letting them think you don't even know what you are talking about, or you don't even know what you want to say. Yeah. So avoid the usage of this. And note this, that you have to try as possible to answer every question they ask you. And when you don't even know, try to say something. And even trying will bring an idea. But that doesn't necessarily mean if you don't know, you're going to force yourself. No. If you don't know and you've tried and still you don't know, please just say, I have no idea, please. For them to give you the next question. This will help you. Okay. Now, let's go. And after answering the question, say thank you. Okay. And then note this kind of questions that they are going to ask. Some of the questions they're going to ask are idioms. Yes, be prepared for idioms. You're going to be asked questions from idioms, idiomatic expressions. Yes, so some idioms like an apple a day keeps the doctor away. It talks about healthiness, right? You try to say something about it. And then another idiom is don't judge a book by its cover. You see? So learn something about idioms, something small about it, so that you have knowledge about what you're going to be asked. Yes. And then also department at the hospital. You have to know department at the hospital. Okay. We have laboratory, we have the rest, they are there. We have the various wards, male ward, female ward, surgical ward, theater, and all other wards. We have maternity ward and the rest. You have to know all these things, okay? Be prepared for it. Also, you will be asked the question on why do you want to become a nurse? This is a critical question Why do you want to become a nurse? You yourself ask yourself that question before you enter there and be prepared for why do you want to become a nurse. Prepare yourself before you enter. Yes. And then among, they will ask some questions like, among the other institutions, why did you choose this school or this college? You'll be asked that question. Among the other institutions, why do you choose this college or school? You have to be very smart at this and also answer this question very smartly. Okay? Looking at the other schools you chose. You could say it's because you've heard a lot about them and you know that they've trained noble nurses who are now professional nurses and they're doing well. You deem it right to be part of this institution. Something, just say something. Yes. And then some question will be asked on your electives, that is SHS, your electives that you did at the SHS. Yes, if you did general arts, you're going to be asked some electives on elective maths, economics, CRS, history, literature, and the rest. So you have to be very, very prepared. Learn about the basics. Okay, when you do CRS, probably they're going to ask you a question from the Bible. So be prepared. And when they comes, they're going to ask you something. When they history, they're going to ask you something about history, and then the Sagranti War, whatever, they're going to ask you. With this science, you did agric, you did the rest, be ready. You're going to be asked questions on it. Yes. So you have to be very, very smart and then know the basics of your electives. When you did economics, home economics, be ready that you'll be going to be asked something about food and nutrition and the rest. Yes. So to end with, you're going to be asked questions on current affairs. Yes, current affairs. What is going on in the country? What is going on in the world? When you were coming, what did you hear on the news? You have to know something that is going on in the country. Yes, normal things that is going on in the country. You have to know. That is the current affairs. And I know some of the names of the ministers. Minister for um, education and minister for what, health. Yes, they could ask you trade and the rest and housing. You have to be prepared for all this. Be prepared. And I know for sure that everything will be smooth if you are confident enough and you are prepared enough. Be prepared for any question that will come. Not to forget, critical questions might be also be asked. Okay, critical questions like basics. It could be something home-based things, something you do at home. Some critical questions. Some questions like, imagine coming to the hospital and you see a patient lying on the floor bleeding, and then a pregnant woman who is also in the time is due, okay, labor, and then these two people, who are you going to rescue first? This is critical thinking. And then also, when you were on your way coming to the interview, what and what did you saw on the way? Some were moving, some weren't moving. What and what did you see that weren't to move? When you are coming, the road doesn't move, the trees doesn't move. So you have to be very, very smart. Okay, all the best or the best. Thank you, your girl, Atranshura. Love you all.